Assalamu alaikum. Today's topic is nutrition in pregnancy. I'm Dr. Sabira Dkhar, demonstrator in the Department of Community Medicine, GMC Srinagar. The Academy of Nutrition and Dietetics recommends the following key components of a healthy lifestyle during pregnancy. 1. Being the appropriate weight gain during pregnancy. 2. Maintaining a balanced diet. 3. Regular exercise. 4. Appropriate and timely vitamin and mineral supplementation. The caloric recommendations. The calorie intake during the first trimester does not require any extra calories. During the second trimester, an additional 340 calories a day are recommended. For the third trimester, the recommendation is 450 calories more a day than when not pregnant. Increased nutrients. Although the old age of saying eating for two isn't entirely correct, you do require more micronutrients and macronutrients to support you and your baby. Micronutrients are the dietary components such as vitamins and minerals that are not only required in relatively small amount. Macronutrients are nutrients that provide calories or energy like carbohydrates, proteins, and fats. You'll need to eat more of each type of nutrients during pregnancy. The increased nutrients. For calcium, we have 1200 milligrams. For folate, it's 600 to 800 micrograms. For iron, it's 27 milligram. For protein, it's 70 to 100 grams per day, increasing each trimester. The fluid intake during pregnancy. Since you need more water during pregnancy, how much is enough? It's recommended that you drink 8 to 12 glasses of water a day or 2.3 liters. If your trips to the bathroom are frequent and your urine is pale or colorless, you're drinking on the track. Foods to avoid during pregnancy. There are 11 food and beverages to avoid during pregnancy. Things which are not to be eaten. High mercury fish or mercury, which is a highly toxic element. Undercooked, raw and processed meat or fish. Raw eggs, organ meat, caffeine, raw sprouts, unwashed produce, unpasteurized milk, alcohol, processed junk food. Guidelines for safe food handling. Wash. Rinse all raw produce thoroughly under running tap water before eating, cutting or cooking. Clean. Wash your hands, knives, countertops and cutting boards after handling and preparing uncooked food. Cook. Cook beef or poultry to a safe internal temperature verified by a food thermometer. Chill. Promptly refrigerate all perishable food. Perinatal vitamins and mineral supplements. All nutrients are important, but these six play a key role in your baby's growth and development during pregnancy. Folic acid, iron, calcium, vitamin D, DHA, and iodine. What and how much to eat? Eat a variety of food to provide everything you and your baby needs. It's not that different from a regular healthy eating plan, it's just amplified a bit. Continue to eat as you normally would in your first trimester, then increase 350 calories daily in your second trimester and 450 calories daily in your third trimester as your baby grows. As often as you can, avoid overly processed junk foods. Chips and soda, for example, contains no nutritional value. You and your baby will benefit more from fresh fruits, vegetables, and lean proteins such as chicken, fish, beans, or lentils. This doesn't mean that you need to avoid all of your favorite foods during pregnancy. Just balance them with nutritious foods so that you don't miss any important vitamins or minerals. Proteins. Protein is critical for ensuring the proper growth of baby's tissue and organs, including the brain. It also helps with breast and uterine tissue growth during pregnancy. It even plays a role in your blood supply, allowing more blood to be sent to your baby. Your protein needs increase during each trimester of pregnancy. You'll need to eat about 70 to 100 grams of protein a day, depending on your weight and which trimester you're in. Calcium. Calcium helps build your body's bones and regulates your body's use of fluids. Pregnant women need 1000 milligrams of calcium. ideally in 2 doses of 500 mg per day. You'll likely need additional calciums to supplement regular prenatal vitamins. Folate. Folate, also known as folic acid, plays an important part in reducing the risk of neural tube defects. There are major birth defects that affect the baby's brain and spinal cord, such as spina bifida. Neural tube defects can lead to varying degrees of paralysis, incontinence, and sometimes intellectual disability and anencephaly. When you are pregnant, the American College of Obstetrics and Gynecology (ACOG) recommends 600 to 800 micrograms of folate. Folic acid can help reduce the risk of neural tube defects, which are birth defects of the brain and spinal cord. It is most helpful during the first 28 days after conception, when most neural tube defects occur. Unfortunately, you may not realize that you are pregnant before 28 days. Therefore, your intake of folic acid should begin before conception and continue throughout your pregnancy. Other considerations. Other nutrients are necessary to keep you thriving during your pregnancy, like choline, salt, and vitamin B. Sufficient amount of certain nutrients including folate, iron, and choline from food alone can be achieved. Make sure to speak with your doctor about which prenatal vitamins you should take. Iron. Iron works with sodium, potassium, and water to increase the blood flow. This help ensures that enough oxygen is supplied to both you and your baby. You should be getting 27 mg of iron per day, preferably alongside some vitamin C to increase the absorption. Cravings and food aversions. During pregnancy, one may also have cravings for at least one type of food. Pregnancy cravings, one might start aching for a donut, Chinese food, or a strange food combination like the classic pickles and ice cream. It's unclear why women who develop food cravings or aversion during pregnancy. However, it is believed that hormones have a play to it. It's fine to give in to these cravings sometimes, especially if you crave for foods that are a part of a healthy diet. However, you should try to limit your intake of junk food and processed food. There's usually a tasty alternative that will be a better option for cravings. Pregnancy aversions. Food aversions, on the other hand, may only be problematic if they involve foods that are important for baby's growth and development. Talk to your doctor if you have aversions to food you should be eating during pregnancy. Your doctor can suggest other foods or supplements to compensate for the lack of those nutrients in your diet. Pica. Pica is a disorder that causes cravings for items that contain no nutritional value. Pregnant women with pica may want to eat clay, cigarette ashes, or starch, among other strange substances. When a woman has pica during pregnancy, it may indicate a lack of specific vitamin or mineral. It's important to notify your doctor if you crave non-food items or have eaten non-food items. Eating such items can be dangerous for you and your baby. Healthy weight gain during pregnancy. If you're concerned about weight gain, don't stress much. Some weight gain is normal during pregnancy. The extra weight provides nourishment to the baby, and it is also stored for breastfeeding after the baby is born. A woman gains an average of 10 to 13 kgs during pregnancy. It's normal to gain less weight if you start out with more weight, or to gain more weight if you have underweight or less weight during pregnancy. You can speak with your doctor about appropriate weight gain during your pregnancy. Takeaway message. Make sure you're eating a balanced and nutritious diet during your pregnancy so you and your growing baby can be as healthy as possible. Include whole, nourishing food and limit your intake of food without good nutritional value like processed and fast foods. Takeaway message. Eat these: proteins with every meal, snacks of whole grain, 5 or more servings of fruit and vegetables per day, dairy products or high calcium foods, essential fats and prenatal vitamins. Avoid these: alcohol, excessive caffeine, raw meat and seafood with high mercury content, uncooked processed meat, unpasteurized dairy, refrigerated smoked food. I hope this presentation has cleared your idea about what to be eaten during pregnancy. Thank you.